There are certain principles that must be followed when debriding a traumatic wound. Firstly, dirt and debris must be gently removed to expose any underlying tissue damage. It is important to use a swab on an artery forceps to keep your fingers away from the tissue, as there may be sharp materials concealed in the wound. Use a systematic approach, starting at the centre of the wound and working out to the periphery. Gently sweeping the debris away shows that there is a lot of dirt in this wound. After an initial washout, forceps may be used to inspect the wound. Any foreign bodies should be removed using the forceps. This should prevent any ongoing infection. Deep within this wound, there is a damaged tendon, which will need to be repaired at a later stage. Working systematically around the wound in an anti-clockwise fashion, any devitalized tissue should be identified and removed. The solid object embedded within the wound symbolizes a piece of broken glass, emphasizing the importance of using forceps when performing this procedure. The next step is to irrigate the wound with saline, using a pulsed pressure of fluid to clear the tissues. A swab is then used to gently mop out and clear the wound. Any deeper areas of damage should also be irrigated to ensure that the wound is clear. Areas of devitalized tissue must be removed, and in general, it is better to remove too much tissue rather than too little. Any small cavities found during the inspection should be enlarged so that they are continuous with the main wound and all devitalized tissue excised. Once the wound is clear, it is important to insert a pack. In this case, a saline wick is gently inserted to hold the wound open, and the tail is trimmed to allow easy removal. In some cases, it may be necessary to place a loose suture across the pack to hold it in place.